Hello friends, welcome back to AIT Learning Hub. It has been a while since I uploaded the first part of the video on appendicular skeleton. If you have not watched the first part of this video, I have provided the link in the description box below. Before we start, I kindly ask you to like, comment and subscribe to our channel. Your feedback is important to us, so please share your thoughts in the comment section after watching the video. Thank you. Today's lecture focuses on the bones of the lower limb, and we begin with the pelvic girdle. The pelvic girdle is a ring-like bony structure located in the lower part of the trunk, connecting the axial skeleton to the lower limbs. Moving on to the structure of the pelvis. The bony pelvis consists of two hip bones, the sacrum and the coccyx. There are four articulations within the pelvis. The sacroiliac joints are two joints located between the ilium of the hip bones and the sacrum. Sacrococcygeal symphysis between the sacrum and the coccyx. Pubic symphysis between the pubis bodies of the two hip bones. The major functions of the pelvic girdle includes transfer of weight, provides attachment for number of muscles and ligaments, contains and protects the abdominopelvic and the pelvic viscera. The greater pelvis, also known as the false pelvis, is located superiorly. It provides support of the lower abdominal viscera, such as the ilium and the sigmoid colon. It has little obstetric relevance. Lesser pelvis, which is also known as the true pelvis, is located inferiorly. Within the lesser pelvis reside the pelvic cavity and the pelvic viscera. The junction between the greater and the lesser pelvis is known as the pelvic inlet. The outer bony edges of the pelvic inlet are called the pelvic brim. The pelvic inlet marks the boundary between the greater pelvis and the lesser pelvis. Its size is defined by its edge and the pelvic brim. There are three borders of the pelvic inlet: posterior or the sacropromontory, superior portion of the sacrum and the sacral wings; anterior, the pubic symphysis; lateral, accurate line on the inner surface of the ilium, and the pectineal line on the superior pubic ramus. The pelvic inlet determines the size and shape of the birth canal, and the prominent ridges are a key site for muscle and ligament attachment. Moving on to the pelvic outlet. The pelvic outlet is located at the end of the lesser pelvis and the beginning of the pelvic wall. It has three borders: the anterior border or the pubic arch, posterior border, the tip of the coccyx, lateral border, the ischial tuberosities, and the inferior margin of the sacrotuberous ligament. The pelvis has various adaptations for childbirth. Most women have a gynoid pelvis, unlike the male android pelvis. The slight difference in their structures create a greater pelvic outlet adapted to aid the process of childbirth. When comparing the two, the gynoid pelvis has a wider and broader structure, yet it is lighter in weight. An oval-shaped inlet compared with the heart-shaped android pelvis. Less prominent ischial spines allowing for greater bispinaeus diameter. A greater angled subpubic arch more than 80 to 90 degrees. A sacrum that is shorter, more curved, and with a less pronounced sacral promontory. In this picture, you can see the differences between a gynoid pelvis and an android pelvis. Why there are wider and broader pelvis in a gynoid pelvis, there is less prominent ischial spines, while the android pelvis has a longer sacrum and a narrow subpubic arch. The next lower limb bone we are going to discuss about is the femur. This is one of the most important bones present in the lower limb of our body. The femur is the only bone in the thigh and the longest bone in the body. It acts as the site of origin and attachment of many muscles and ligaments and can be divided into three parts: proximal, shaft, and the distal part. The proximal part of the femur. The proximal aspect of the femur articulates with the acetabulum of the pelvis to form the hip joint. It consists of a head, neck, and two bony processes, the greater and the lesser trochanters. Two bony ridges connect the two trochanters, the interotrochanteric line anteriorly and the trochanteric crest posteriorly. The head of the femur. This articulates with the acetabulum of the pelvis to form the hip joint. It has a smooth surface covered with articular cartilages except for the small depression, the fovea, where the ligamentum teres attaches. The neck of the femur connects the head of the femur with the shaft. It is cylindrical, projecting in a superior and medial direction. It is set at an angle of approximately 135 degrees to the shaft. This projection angle allows for an increased range of movement at the hip joint. The greater trochanter is the most lateral palpable projection of bone that originates from the anterior aspects, just lateral to the neck. It is the site of attachment for many of the muscles in the gluteal region, such as the gluteus medius, gluteus minimus, and the piriformis. The vastus lateralis originates from this site. An avulsion fracture of the greater trochanter can occur as a result of forceful contraction of the gluteus medius. The lesser trochanter is smaller than the greater trochanter. It projects from the posterior medial side of the femur, just inferior to the neck of the shaft. It is the site of attachment of the iliopsoas. Forceful contraction of this can result in a fracture of the lesser trochanter. Intratrochanteric line, a ridge of bone that runs in an inferior medial direction on the anterior surface of the femur, spanning between the two trochanters. After it passes the lesser trochanter on the posterior surface, it is known as the pectineal line. It is the site of attachment of the iliofemoral ligament, the strongest ligament of the hip joint. It also serves as the anterior attachment of the hip joint capsule. Interotrochanteric crest. Like the intratrochanteric line, this is a ridge of bone that connects the two trochanters. It is located on the posterior surface of the femur. There is a rounded tubercle on its superior half called the quadrate tubercle, where the quadratus femoris attaches. This picture shows the posterior surface of the right femur. It consists of the head, neck, the trochanteric crest, the greater trochanter, lesser trochanter, the gluteal tuberosity, pectineal line, and the linea aspera. The shaft of the femur. The shaft of the femur descends in a slight medial direction. This brings the knees closer to the body center of gravity, increasing stability. On the posterior surface of the femoral shaft, there are roughened ridges of bone called the linea aspera, Latin for rough line. This splits distally to form the medial and the lateral supracondylar lines. The flat popliteal surface lies between them. Proximally, the medial border of the linea aspera becomes the pectineal line. The lateral border becomes the gluteal tuberosity, where the gluteus maximus attaches. Distally, the linea aspera widens and forms the floor of the popliteal fossa. The medial and lateral borders form the medial and lateral supracondylar lines. The medial supracondylar line ends at the adductor tubercle, where the adductor magnus attaches. The distal end of the femur is characterized by the medial and lateral condyles, which articulate with the tibia and patella to form the knee joint. The medial and the lateral condyles are rounded areas at the end of the femur. The posterior and inferior surfaces articulates with the tibia and the menisci of the knee, while the inferior surface articulates with the patella. Medial and lateral epicondyles are bony elevations on the non-articular areas of the condyles. The medial epicondyle is larger. The medial and lateral collateral ligaments of the knee originate from the respective epicondyles. Intracondylar fossa, a deep notch on the posterior surface of the femur between the two condyles. It contains two facets for attachment of intracapsular knee ligaments. The anterior cruciate ligament attaches to the medial aspect of the lateral condyle and the posterior cruciate ligament to the lateral aspect of the medial condyle. Next, we are going to talk about the patella. The patella, also known as the kneecap, is located at the front of the knee joint within the patellofemoral groove of the femur. Its superior aspect is attached to the quadriceps tendon and its inferior aspect is to the patellar ligament. It is classified as a sesamoid type bone due to its position within the quadriceps tendon and is the largest sesamoid bone in the body. The patella has a triangular shape with anterior and posterior surfaces. The apex of the patella is situated inferiorly and is connected to the tibial tuberosity by the patellar ligament. The base forms the superior aspect of the bone and provides the attachment area for quadriceps tendon. The posterior surface of the patella articulates with the femur and is marked by two facets. Medial facet articulates with the medial condyle of the femur. Lateral facet articulates with the lateral condyle of the femur. The patella has two main functions. Leg extension. This enhances the leverage that the quadriceps tendon can exert on the femur, increasing the efficiency of the muscle. Protection. It protects the anterior aspect of the knee joint from physical trauma. Next, we are going to talk about the tibia. The tibia is the main bone of the lower leg, forming what is more commonly known as the shin. It expands at the proximal and distal ends, articulating at the knee and ankle joints respectively. The tibia is the second largest bone in the body and it is a key weight bearing structure. The proximal tibia is widened by the medial and lateral condyles, which aid in weight bearing. The condyles form a flat surface known as tibial plateau. Located between the condyles is a region called intercondylar eminence, which projects upwards on either side as the medial and lateral intercondylar tubercles. This area is the main site of attachment for ligaments and the menisci of the knee joint. The intercondylar tubercles of the tibia articulate with the intercondylar fossa of the femur. This figure explains the structures present in the tibial plateau: the intercondylar eminence, the medial condyle, the medial intercondylar tubercle, the lateral intercondylar tubercle, and the lateral condyle. The distal end of the tibia widens to assist with weight bearing. The medial malleolus is a bony projection continuing inferiorly on the medial aspect of the tibia. It articulates with the tarsal bones to form part of the ankle joint. On the posterior surface of the tibia, there is a groove through which the tendon of tibialis posterior passes. Laterally is the fibular notch, where the fibula is bound to the tibia, forming the distal tibiofibular joint. Shaft of the tibia is prism shaped, with three borders and three surfaces: anterior, posterior, and lateral. Anterior border palpable subcutaneously down the anterior surface of the leg as the shin. The tibial tuberosity marks the anterior border's proximal aspect, the patellar ligament's attachment site. Lateral border, also known as the interosseous border. It gives attachment to the interosseous membrane that binds the tibia and the fibula together. Posterior surface marked by a ridge of bone known as soleal line. This line is the site of origin for parts of soleus muscle and extends inferior-medially, eventually blending with the medial border of the tibia. There is usually a nutrient artery proximal to the soleal line. We now move on to discuss the fibula. The fibula is a bone located within the lateral aspect of the leg. Its main function is to act as attachment for muscles and not as weight bearer. It has three main articulations. Proximal tibiofibular joint articulates with the lateral condyle of the tibia. Distal tibiofibular joint articulates with the fibular notch of the tibia, and the ankle joint articulates with the talus, a bone of the foot. At the proximal end, the fibula has an enlarged head, which contains a facet for articulation with the lateral condyle of the tibia. On the posterior and lateral surface of the fibular neck, the common fibular nerve can be found. The fibular shaft has three surfaces: anterior, lateral, and posterior. The leg is split into three compartments, and each surface faces its respective compartment. Example: anterior surface faces the anterior compartment of the leg. Distally, the lateral surface continues inferiorly and is called the lateral malleolus. The lateral malleolus is more prominent than the medial malleolus and can be palpated at the ankle on the lateral side of the leg. The last set of bones in the appendicular skeleton are the foot bones. The bones of the foot provide mechanical support for the soft tissues, helping the foot withstand the weight of the body while standing and in motion. They can be divided into three groups: tarsals, a set of 7 irregularly shaped bones. They are situated proximally in the foot in the ankle area. Metatarsals connects the phalanges to the tarsals. They are 5 in number, 1 for each digit. Phalanges, the bones of the toes. Each toe has 3 phalanges: proximal, intermediate, and distal, except the big toe, which only has 2 phalanges. The foot can also be divided up into 3 regions: hindfoot, talus, and calcaneus; midfoot, navicular, cuboid, and cuneiforms; and forefoot, metatarsal, and phalanges. The tarsal bones of the foot are organized into 3 rows: proximal, intermediate, and distal. The proximal tarsal bones are the talus and the calcaneus. They comprise the hind foot and form the bony framework around the proximal ankle and heel. The talus is the most superior of the tarsal bones. It transmits the weight of the entire body to the foot. It has 3 articulations: superiorly ankle joint between the talus and the leg bones, inferiorly subtalar joint between the talus and calcaneus, anteriorly the talonavicular joint between the talus and the navicular. The talus transmits forces from the tibia to the calcaneus, providing stability to the ankle. The talus has many ligament attachments but no muscle attachments, increasing the risk of avascular necrosis due to its reliance on fascial structures for blood supply. The calcaneus is the most prominent tarsal bone and lies underneath the talus, where it constitutes the heel. It has 2 articulations: superiorly subtalar joint, anteriorly calcaneocuboid joint. It protrudes posteriorly and takes the weight of the body as the heel hits the ground when walking. The posterior aspect of the calcaneus is marked by calcaneal tuberosity, to which the Achilles tendon attaches. The intermediate row of tarsal bones contains one bone, the navicular, given its name because it is shaped like a boat. The navicular bone is located in the middle of the foot and connects with other bones. It has a tuberosity on its plantar surface for the tibialis posterior tendon. In the distal row, there are 4 tarsal bones, the cuboid and the 3 cuneiforms. These bones articulate with the metatarsals of the foot. The cuboid bone is located on the outer side of the foot, in front of the heel and between the 4th and the 5th metatarsals. It has a cuboidal shape and a groove on its underside for the fibularis longus tendon. The 3 cuneiform bones are wedge-shaped and form a transverse arch in the foot. They connect to the navicular and metatarsals, serving as a muscle attachment points. Medial cuneiform, tibialis anterior, tibialis posterior, and fibularis longus. Lateral cuneiform, flexor hallucis brevis. The metatarsals are located in the forefoot between the tarsals and phalanges. They are numbered 1 to 5, medial to lateral. Each metatarsal has a similar structure. They are convex dorsally and consist of a head, neck, shaft, and base, distal to proximal. They have 3 or 4 articulations: proximally tarsometatarsal joints between the metatarsal bases and the tarsal bones; laterally intermetatarsal joints between the metatarsal and the adjacent metatarsals; distally metatarsophalangeal joints between the metatarsal head and the proximal phalanx. The phalanges are the bones of the toes. The 2nd to 5th toes all have proximal, middle, and distal phalanges. The great toe has only 2 proximal and distal phalanges. They are similar in structure to the metatarsal. Each phalanx consists of a base, shaft, and head.
Before ending this video, I want to share some fun facts with you. I hope you enjoyed this video and others on our channel. If you like the content, please like, share and subscribe to our channel. Thank you for your time.
Tips. In the male ear is the smallest and lightest bone of the human skeleton. The hyoid bone is the only bone in the human body that is not connected to another bone.